know what the examiners want. The examiners do not expect you to know it all. Their primary concern is to see if you have what it takes to be a safe house officer. Read the instructions carefully and do as required during the exams. A good mentor would help you, among other things, to understand how the examiners think and how they want their questions answered. Our examiners have their favorite topics and questions and how they expect these questions to be answered. For instance, if you cannot comfortably cover topics such as malaria, hypertension, diabetes, postpartum hemorrhage, preeclampsia, febrile convulsions, etc., then I'm afraid you are not ready yet. You have to prepare well and face them another time. You must be able to demonstrate that you know the basics to keep a patient alive. You should be able to recognize emergencies and resuscitate. You should also be able to demonstrate that you know your limits. Don't forget that little things, such as we often take for granted, are crucial. Little things such as setting an IV line, passing an NG tube, passing a urethral catheter, doing the bedside clotting time, urine dipstick, checking RBS, checking blood pressure, doing a lumbar puncture, setting up oxygen for a patient, doing a CPR, knowing the common instruments that are used. These are also essential. It's all part of what the examiners want. And you need to apply yourself and make sure that you've paid attention to all these areas and covered them well, so that you can confidently face the examiners. 8. You may have to learn and unlearn. Sometimes we are unable to learn the right thing because our cups are full. By our cups being full, I mean thinking that you know it all. There are some bad habits that can put you at a disadvantage. And so there are some habits, some traits that we may have to discard. And then there are also new ones that we'll have to acquire so that we'll be at an advantage during the exam. For instance, if you have a habit of repeating every question that you are asked, so you are asked, what is postpartum hemorrhage? And your reply is, what is postpartum hemorrhage? What is postpartum hemorrhage? Before you eventually give your answer. This habit will cost you. Repeating the question can be irritating to an examiner. So if that is your habit, you will have to unlearn it. How will you do that? We'll discuss that. Also, if you have a habit of starting to answer a question without first thinking it through, so you are asked the question, yes, so you are asked the question, and as soon as the question ends, you start answering, only to get stuck halfway, and then you ask, please, can you ask the question again? If you do so, you are demonstrating to the examiner that you are not somebody who thinks before he speaks. You are impulsive, and that is not a habit we encourage in medicine. If you have that habit, you will have to unlearn. If you have a habit of using abbreviations, FBC, ECG, GXM, if you have that habit, you will have to discard it for the purposes of this exam, because sometimes when you've used the abbreviations over and over and over again and everybody is assuming you know what it stands for, under pressure when you are asked, it becomes difficult to recall what it actually means. People, for instance, HPT, some people say, to most people they think it's hypertension. Other places where you find that people write HTN for the same hypertension. It is safe, if you have a habit of using abbreviations, to unlearn that habit and begin to use the full meaning so that it becomes a part of your life. You may also have a habit of speaking inaudibly when you are under tension. So when you feel like the examiners are heckling you and they ask you a question and your answer is very quiet and timid and the examiners can't even hear you, they have to strain their ears to hear you. My friend, they will not do that for you. You will have to make it a habit to speak up. You may be wrong, but what if you are right but they didn't hear you? You see, so you will have to unlearn such a habit. If you have a habit of being afraid to make eye contact, you will have to unlearn that habit and now acquire a new habit of looking people in the eye, because you are trying to sell your potential to the examiner, telling the examiner that you are honest, you are determined, you are confident, and that you deserve a chance, you deserve to pass the exam. How can you convince somebody when you can't look them in the eye? As if you are feeling guilty, you feel intimidated. That will not be in your favor. Also, if you lack the confidence to speak in public, then you will have to unlearn that and begin to practice how to speak up in public. Because if you don't speak during the viva, then you can't be helped, because all your answers will stay in your mind. The examiners will not have any way of assessing your level of knowledge. So you have to speak up. So you will have to practice, look at these few points I've suggested, and see the areas where you need to improve. 9. Be alert to what's happening around you. Make time to follow the news highlights, especially health issues. For instance, you can be sure that since we are in year 2020, COVID-19 will be the most important health issue, and it will feature in the upcoming exams, especially for public health, for internal medicine, for pediatrics. You will have to follow what is going on. For instance, if you are asked in public health, what is epidemiology? And you can't answer. If you are talking about contact tracing and you don't know what it is, if the pooling of the samples that were done at Noguchi is something you haven't heard about, and you don't even know how the samples are collected, you think they are drawing blood or they are using urine to test, you will not make a good impression. you have to stay current. I'm not suggesting that you should spend all your time following the news, but it's important to be aware of what is happening around you. Also, part of the component of being alert to your environment, it means that you should constantly be reminding yourself that you are in Ghana and that you are going to practice in Ghana, and whatever question you are asked, your answer should be what you will do as a doctor practicing in Ghana. So when you think about your answer, ask yourself, what is the recommended practice in Ghana? On the wards, in the hospitals, what do I find the doctors doing? What do I see the seniors doing? And that will be the answer that you should give. If you cast your mind back to the countries where you trained and you begin to think about the things that they were doing there, it may not be helpful, it may not be applicable in our setting. So be conscious that you are in Ghana. Don't forget that we are a developing country with very limited resources. So in giving your answer, think about what you would do if you were in a district hospital. Don't go for very big fanciful things. CT scans, MRI, PET scans, these may have their place in the answers you give, but go for the simple ones first. Go for the simple ones first where applicable. 10. Embrace the possibility of failure. Someone said, the only thing to fear is fear itself. It is what you do with your fears that determine whether you are courageous or you are a coward. Don't let fear so overtake you that you lose your ability to do something. When you begin to sense fear and anxiety toward the exams, take a deep breath and ask yourself, what's the worst that can happen? The answer, the worst that can happen is that you will fail the exams. So ask yourself again, what do I have to do to fail the exams? The answer is nothing. You can just sit there and feel sorry for yourself. On the day of the exam, D-Day, just show up, write your index number and walk out. My grandmother can take the medical and dental council exam and fail. So it is very easy to fail the exams. If that is the case, then what can you do to ensure that you pass the exam? Your concern should be, how do I pass the exam, and not what will make me fail the exams. If your concern is how to fail the exams, then you don't have to do anything. But if my illiterate grandmother could fail this exam, are you the same as my illiterate grandmother? Certainly not. Don't you know more than she does? Sure. Did you come all this way just to stop short of being a real doctor? I mean real doctor, practicing doctor. You become afraid when you are not angry, my brothers and sisters. You are not angry enough. That's why you have room for fear. You need passion. Passion in this sense is a mixture of anger and love. It is powerful. You should be angry. Why should you allow some examiners who know nothing about who you are, where you come from, and what you've been through to determine your destiny? Take charge of your own destiny. Do you want to be a statistic? For us to say you just took part in the exam and you failed, you just donated $720 to charity. Do you want to be numbered with the dadabes, spoiled kids, as those who failed? Remember, they are chilling. Whether they win whether they pass this exam or fail, some of them have other alternatives. They will still continue to enjoy. You probably do not have any such alternative. You may be one of those whose family members are calling them for money because they've heard that you are a doctor. You are hustling. You must always remember that life is not fair. It has never been and will never be. So keep your focus. What is fear when you know that passing this exam will open doors for you? What is fear when you know that passing this exam will give hope to a little kid somewhere dreaming of becoming like you? What is fear? When passing this exam will give you a bridge to cross to the other side of poverty. The world is not interested in your suffering, so stop pitying yourself. The world is waiting for you to use your story to inspire the hopeless. So don't be afraid. Get yourself together and take what belongs to you. Fight. 11. Spend quality time on the wards. It's very easy to get lost in the routines of the hospital to the extent that you forget why you are there in the first place. For starters, there are beautiful nurses and female medical students competing for your attention and distraction. There's also this tendency to enjoy playing doctor on the wards, at the ER or the consulting rooms on the wards, so much that you forget that you've not passed the exams yet. Medicine is mostly hands-on, so after a while on the wards, you begin to get used to tracking a patient, ordering investigations, prescribing medications, doing ward rounds, doing reviews. Remember, doing what doctors do with ease is supposed to boost your confidence that you are good enough. That's all. Stay focused. The fact that you can do what doctors do easily does not mean you are qualified. You need a certificate. The license proves that by passing the exam. You have to set weekly targets for what you want to learn on the wards. So ask yourself, what do I want to learn on the ward, on the children's ward this week? Go there, learn that thing, and leave that place as soon as you can. When you get to the wards, during the ward rounds, be quick to ask all those silly questions, silly in quotes. Display your ignorance and allow yourself to be taught. Don't worry that others might think you are not smart. Ask the questions during the ward rounds. Expect to be flawed. Expect to be pummeled with questions left, right. Expect that at some point you'll be made to feel, for lack of a better word, useless. In fact, you have to learn how to use the ward rounds to build your confidence. So today, we were on the ward. We asked a question on how to test for the malaria parasite. You got it wrong. Maybe somebody laughed at you. You're a bit shy or you're embarrassed. Let that motivate you to go and read everything about malaria. Now come to the word the next time. Examiners, the seniors, we don't have plenty questions. It's the same questions that we asked over and over and over again. You'll be asked the same question another time. Then you answer confidently, correctly, and impress the examiner, the senior, and you find that you will be confident. You find that you will feel good about yourself. Say, yes, I was able to remember and I got it right. And you begin to believe in yourself. Just make sure that you know your patient very well. If you do that, you could present your case to a house officer, to an MO, even the day before the ward rounds, so that they can make corrections for you. Remember, there will always be days where you leave the ward rounds feeling wasted and discouraged. When that happens, use your discomfort to challenge yourself to become better. Read and fight. Don't let the time that you spend on the wards be wasted. Lastly, form a study group and practice with them. If you choose your study group members carefully, they will serve you well. There's something wonderful about exchanging ideas. When 2, 3, 4 people are on the same wavelength, brainstorming about a common subject, a common topic, no matter how difficult it is, suddenly ideas come from all over, out of nowhere, and you're able to get answers. At least if you don't get the answers, you will know who to go to or where to go for the answers. Jesus said, "Where 2 or 3 are gathered in my name, I am in their presence." You can't do it all by yourself. There's a proverb that says, if you want to go fast, go alone. If you want to go far, go together. Work together as a team and help one another to pass the exam. Your common enemy is the MDC exams. It's not your fellow candidate. After all, if because of you somebody passes the exams, I believe that you forever, the person will forever be grateful to you. You would feel that you've done something positive. And whenever you give something in this life, you receive something in return. So it's important that you form a study group, choose the members wisely, carefully, do away with people who will pull you back. But it is better to work, to study in a group, than to be a lone wolf trying to do everything by yourself. You'll be at a disadvantage. Okay, so there you have it. I hope you found the 12 tips useful. The MDC exams has been passed by men and women just like you. You are not alone. Go for it. If you'd like to know what to do to pass the exam at the first attempt, subscribe and stay tuned to this channel. Share it with your friends, and thanks for watching. All the best.